Some of our main priority areas are helping patients and families in crisis, preventing addiction. This is an entirely preventable disease, right? So focusing and investing in prevention is incredibly important. We also work to improve access to quality treatments and work to integrate the treatment of substance use disorders into the healthcare system, and we work to end stigma. So a couple items that I'm going to go through with you today are understanding addiction, a little bit on alcohol, preventing substance use disorders and some key strategies, responding to a disease and looking at what we can learn from other disease models, and then share with you some training and resources, and throughout the presentation, show you some videos. And these are free open source resources that you can use in your own communities, your own family, your own networks, your own schools. So a little bit of starting at sort of the basic level on understanding addiction. We know the prevalence of addiction is quite high in the US. We have 20 million people who are suffering from substance use disorders in the US. That number is likely to have increased over the last 15 months due to the pandemic. We are seeing increases of alcohol and other substance use as a result of the stress and anxiety of COVID-19. We also know that most of us know someone who is or has struggled with addiction. A Pew Charitable Trust a survey showed that 50% of US adults have someone in their own family or friend network who has struggled with an SUD. 23 Americans are in recovery from a substance use disorder. So taken together, this affects so many of our communities and so many of our families. Some of the other things that I think are important just in terms of the numbers are that 90% of those that have a substance use disorder began use of substances before the age of 18. So when you look at this from a medical framework, this is a pediatric brain disorder, meaning that its onset is in the childhood or the adolescent years. We also know that about 50% of those 20 million who have an addiction currently, or 50% of the 23 million in recovery, have a genetic predisposition. So about half of both of those populations have this in their family, and it is not one gene, it is a constellation of over 20 genetic factors that increase your risk for a substance use disorder. Now, this is the part that everyone is, I feel like we're kind of still in the, we play drug du jour, which is a little bit like playing whack-a-mole. Like you're like, we whack, this is an opioid, or it's prescription drugs, or we're doing methamphetamines, or we're doing vaping, or we're doing, but the reality is we have a polysubstance use disorder issue. People use multiple substances, but if you're looking at a primary substance that individuals struggle with, 15 million of the 20 million are struggling with alcohol use disorder, right? So for all of the headlines and all the focus on opioids, cocaine, methamphetamine, we have 3/4 of the addiction in this country is related and caused by alcohol use disorder. And I think we really need to understand that this is usually sort of a substance of first misuse or initiation, but also can be a primary SUD. Now, the other piece that we really try to underscore is that, and this is sort of, I do a whole talk on the myths around addiction, and the mythology or myths or misinformation on SUDs are so prevalent. Sometimes it's shocking to me how entrenched some of this misinformation can be. But addiction, we have Sandra Bullock movies with 28 Days, and sort of think that this can be cured or alleviated quickly, but this is a chronic health condition, right? Acute conditions, which are short-term, like having the cold or the flu. And then we are very familiar with chronic conditions such as diabetes, asthma, or schizophrenia. And substance use disorder is in that category. And how early you engage a person in treatment is a key factor in that, but it still is a chronic health condition. And one of the other myths and misinformation in the addiction space is that we can sort of see relapse as a failure. Well, I have asthma, and when I have to use my rescue inhaler, it's not a failure. I need to adjust my treatment plan. I need my rescue inhaler. I might need to see my doctor again, but this is sort of part of me having asthma or chronic condition. And the level of relapse is pretty much on par with recurrence or relapses in other chronic conditions, such as type 2 diabetes and hypertension. I think that's really important to remember, especially as we work with families and caregivers who have a loved one struggling, that we need to wrap individuals up with a little bit more care, but not see this as a failure or this is over, sort of throw up our hands. All right. And then the other piece in terms of this being a health condition is addiction affects tissue function, just like this is a example here of a scan of a patient that has heart disease versus a healthy patient. And then this is the brain of someone with a cocaine use disorder versus a healthy patient. So that cocaine, that stimulant use disorder, similar to heart disease, it affects the tissue in your brain versus your heart. And we know that it can be treated and you can recover from these conditions. So making sure we look at this from a medical lens has really been an important priority for APF. We also really try to share information that the DSM-5 is sort of the big book for psychiatry and how we treat mental illnesses and understand mental health conditions. And addiction is in the DSM-5. And that the criteria for an addiction is in sort of 4 different buckets. Impaired control, so you using more than you want to or not being able to cut down. Social problems, whether you're unable to sort of go to work or school or parent or do homework, to neglecting relationships and responsibilities. Risky use, when you are continuing to use despite negative consequences. And physical dependence, needing more of the same substance to get the same effect, also known as tolerance. This is an important thing to note because we know some folks will brag about tolerance development in the alcohol space, and that's actually a risk factor and a sign and a symptom that's in the DSM-5 for development of an alcohol use disorder. And then also symptoms of withdrawal are in that 4th bucket of physical dependence. Now, signs and symptoms outside of the DSM-5 in terms of families and caregivers, when we look and see someone with a change in weight or appearance, acting very differently or withdrawn, tired, nodding off, loss of money or valuables, and some of that behavior can also indicate an addiction. The other piece around the addiction space, and I think this is all important to sort of tee up to the prevention message, so bear with me, but similar to cancer, we know that there are stages in the severity of cancer. And let's say if we've all had someone in our family or friend network, likely who's had cancer. One of the first things you think of is, did I catch it early? Did you catch it early? What stage are you at? And similar to that, there are levels of severity for addiction. And when we talk about someone having an addiction, it means that it's a level 3 severe. Otherwise, it's not classified as having an actual addiction. So that a disease has progressed beyond mild, level 1, moderate, level 2, to level 3, severe, in order to develop that addiction. And the symptoms worsen over this time. The length of time that it takes to increase in severity can really vary based on the level of usage, what substance is being used, and also the age of the patient and other underlying factors and comorbidities. But I think we need to always remind ourselves that this is why prevention is so important. So to prevent people from getting on these steps to begin with, or to intervene before it becomes an addiction, or to get them help immediately or as quickly as possible to intervene early if an addiction is developed. The other piece we really try to share information about is, and one way that I like to describe this is that understanding the biopsychosocial model, and this applies to other chronic health conditions, not just addiction, but there are different factors that go into the development of an addiction and different factors that need to be addressed to have treatment and recovery. So one way to sort of compare this is that we know that there's been an increased number of infants who are born exposed to opioids, for example. So they have a physical dependence on opioids at birth, sometimes referred to as neonatal abstinence syndrome. that infant doesn't have an addiction. That infant has a physical dependence on an opioid. And the reason is that they have a biological response to this because of that physical dependence, but they don't have the psychological pieces or the social pieces, obviously, that usually contribute to an adolescent or an adult's development of a substance use disorder. So we look at the treatment piece. We're going to deal with the biology, which is the physical effects of addiction, any of the genetic vulnerabilities, making sure that all healthcare and physical health is taken care of. But then you need to look at the psychological pieces. One of the biggest elements there in the addiction space is coping skills, right? So many times addiction is sort of poor coping skills gone south, right? We start coping with the stresses of life or work or difficult relationships or family interactions or whatever it might be by drinking, using marijuana, using other substances. And as that increases, we build habits and routines that rely on those substances to handle these everyday stressors in our life. Similarly, we're seeing increasingly people relying on marijuana or alcohol or other substances to sleep every night. So if you need a substance to sleep, to handle the stress of going to school or going to work, this is going to increase your risk of developing a substance use disorder. And as we find treatment and build a treatment and recovery plan for a patient, building new coping skills is going to be an incredibly important part of that. And then the social pieces around this. A lot of our social structures can be organized around alcohol in particular. And so when we're building a treatment and recovery plan, we need to make sure that there are ways for that patient to be pro-social, attached to their community and engaged, and folks that are supportive of their non-use. Another part, I love this is a NIDA brain scan from Dr. Volkoff's work, but the brain can recover. So on the left, you see a healthy person's brain scan, and then someone with a methamphetamine use disorder at 1 month in abstinence or in treatment, and then 13 months later. And you see the similarity between the healthy brain and sort of 14 months into treatment. So we know that we can not only recover and change our habits and our coping strategies and get treatment and recovery, but our brains can heal. And that's an important message for us to be carrying home into our own networks. In terms of risk factors, and we talk about the risk factors for developing an addiction as the big three. And sometimes I use myself as an example. So I'm gonna take that route with you all. And I've been doing this work for a long time because my family is impacted by addiction. I lost both my parents to heroin use disorder, and early in life that meant for me being homeless and then in foster care and ultimately raised by my maternal grandparents. So I have a whopper of the big three when it comes to risk factors, right? I have genetic factors. I can't trace my addiction back more than 4 generations, but there has been severe addiction. My grandma is from the Bay Mills Indian Reservation in UP of Michigan, and her mom struggled with alcohol use disorder. My grandma struggled with alcohol use disorder. My mom struggled with heroin use disorder. So I'm going to assume that I have the genes, and I come by them honestly, as my grandma would say. On the individual side, this is where I made some changes, right? So we can affect our genes. We can change and have an impact on which genes are switched on or off, which is called epigenetics. And some of the decisions that I've made in my personal life, like delaying the age of first use. I had my first sip of alcohol when I was 21, and it was one of the most important strategies that I employed to make sure that I sort of changed sort of the intergenerational nature of addiction in my own family. On the environment side, obviously, homeless parents with IV substance use, foster care wasn't really a walk in the park, and a lot of addiction at home. But those individual factors, even with a patient or someone like me with what seems like insurmountable risk factors when it comes to addiction. For those of you familiar with ACEs, you're not supposed to score a high score on the ACEs side, which is adverse childhood experiences, and I score pretty high. And yet, my grandma would say I turned out okay because those individual factors. So things and some of the strategies that I benefited from being involved in a local coalition helped to sort of right size my protective factors to counterbalance my risk factors. So no child is unsavable, even with a sort of a full deck of risk factors present. The protective factors that we can put into play can counterbalance that and make sure that we are healthy and well and do not develop substance use disorders or behavioral health disorders. This is sort of just a breakdown of some of those risk factors and protective factors. There's that counterbalance to each and every one of these. On the protective factor side, and this is really where the prevention strategies are so important in development, it's delaying initiation, delay. It's attachment and pro-social engagement, doing things for others and feeling like you belong to something that is positive to you is so incredibly important for our adolescents. And the other thing I wanted to mention is that connection to non-parental adults. So that the number of positive relationships you have with healthy adults in your life is such an important counterbalancing protective factor, even for kids impacted by addiction. And that's where a lot of the mentoring programs and community efforts and programs come in, and it's incredibly important. Another note, and this is my addiction boot camp you all are getting, is this a little reminder, and you're going to hear me use terms like substance use disorder. We don't use the word abuse. When you think of abuse, you think of child abuse and other sort of crimes, and addiction is a health condition. So saying a substance use disorder is incredibly important for our patient field. Similarly, we're going to lead with person first language, meaning I'm going to say a person with a substance use disorder to avoid terms like addict or junkie or dope fiend, which was my mom's least favorite term. And I can tell you as a daughter of someone, I lost my mom when she was just 50, and she died of her long-term health consequences of substance use disorder. So I lost her very early, but she would share with me, I think her description was that every time someone called her a junkie, it took a little bit of a piece of her humanity away. So the language that we use helps to bring this into the healthcare sort of field or space. And it also makes sure that we aren't stigmatizing or bringing sort of more prejudice to this area, which will dissuade individuals from seeking the help that they need. We also talk about in recovery, recurrence of use, and positive drug tests, or currently using substances instead of a dirty drug test. My laundry is clean and dirty, not people. All right, so for the so that's my quick boot camp. I have some videos, but I think I'm actually going to share those with you at the end during our resources section, because going back and forth between PowerPoint and my internet browser is probably going to make me mess something up. So I'll share some resources we have in the understanding addiction sort of sphere as well. So let's talk alcohol. There's so much misinformation around alcohol, and as I sort of shared with you, it is the majority of the addiction that we have in the US. Now, the health consequences of alcohol are ridiculous. Everything from heart problems to cancer, pancreas, and of course, liver problems. We've also seen cirrhosis and liver failure numbers up nationwide. We're seeing a lot of increase in alcohol use among all populations, including mom-age folks with sort of the mommy needs wine culture. And I don't think there's enough discussion of the negative consequences on the health side. Now, this is good information for you to share with your adults in your network, this is not information that is going to make much of a difference with our adolescent audiences. I have 3 teenage boys at home, and telling them what they may or may not develop when they're 40, it's just not how the adolescent brain works. But us being aware and sharing information within our networks of sort of the true health consequences of alcohol is incredibly important. I wanted to share some more recent data that's come out. So we're all very aware and cognizant of the linkage between cancer and smoking. There's approximately, I think, 7 million deaths around the world that are attributed to smoking each year, 7 million deaths. But the connection between cancer and alcohol is sort of less understood and less spoken about. So a recent study that was done actually in the UK, but it found that only 13% of adults that were surveyed believe that cancer is a health risk of drinking alcohol, despite some pretty significant research that exists that links it directly to multiple different forms of cancer that affect both men and women. So I wanted to sort of bringing this up here. There's also new research out of Southampton University on alcohol, and it's being classified as a carcinogen, that even moderate drinking can have a profound impact even compared to smoking. And another study went on to find that the risk of drinking 1 bottle of wine per week was equivalent to smoking 10 cigarettes for females and 5 cigarettes for males, which means that the cancer risk associated with wine is double for women than it is for men. And also just sort of thinking in terms of, for me as a female, that 1 bottle of wine, if I were just consuming 1 bottle of wine, and our average consumption is definitely up in the US by individual, but that 1 bottle of wine is equal to 10 cigarettes for me and 5 cigarettes for a male counterpart. And making sure that we understand that and its linkage to cancer, I think, is incredibly important. We also know that a lot of our recommendations are built around a standard drink size, which isn't sort of the amounts that we consume, either when we're served in facilities, whether it's restaurants or bars, or when individuals are drinking at home. So being aware that these recommendations are sort of thrown out the window when we're looking at pours or serving sizes that are double, if not triple, what is recommended. And then so knowing this, so it's bad for your health, it causes cancer, multiple forms of cancer. New research shows that there's increased risk for women over men, which is of concern, that a very small percentage of individuals who consume alcohol understand that the linkage to cancer and some of the other health consequences. So we have a lot of misinformation that exists in the alcohol space. So I wanted to sort of dig in on a few other ones. So number 1 is alcohol as a stress reliever. The data actually shows that how alcohol affects your brain actually increases anxiety and stress, both during consumption and high levels of increased anxiety sort of after. We also hear myths around parents who host issues, that, well, I want to keep my kids safe and their friends safe, so I'm going to provide here. I'm going to, buy the keg or allow the alcohol and let them drink in the basement. When in reality, it's the age and frequency of use of even alcohol among teenagers that can create the biggest risk for future addiction. Another myth is tolerance. Tolerance is not a good thing. If you're developing tolerance, you probably should take a month off of whatever you're doing and building a tolerance to make sure that you can right-size that. It is one of the symptoms in the DSM-5 for developing an addiction. My I think it's hard to rank my least favorite myths when it comes to drinking, but one of them is definitely rock bottom. This applies to all addiction. We have this myth and sort of cultural norm that you should wait for individuals to hit rock bottom, or for them to sort of hit a lowest place on their own where they will seek help and they won't be ready or treatment won't work until they get there. The reality is that we would think it's ridiculous to say that I want to wait for stage 4 to get my mom or sister or aunt or brother in to treat his cancer or her cancer. And when we wait for rock bottom, the reality of that statement is that you are waiting for symptoms to worsen and for that stage or that level of severity to increase. And the sooner you intervene, the better the results are for the patient. So it really is a completely backwards mythology that we have in our society. We talked a little bit about this, 28 days. There's a really famous doc in the addiction space called Dr. Mee Lee, and he says, have you ever been to anyone's schizophrenia graduation? Do you go to big graduation parties for someone's diabetes? Because these 28-day mythology pieces that we have that you're somehow cured after a month or a little under a month of treatment is false, that this requires long-term. Can you hear me? Sorry, dogs. This requires a long-term treatment plan and support for patients, not an acute treatment plan, but a chronic health recovery care plan. And I know this seems a little ambiguous, but in the level playing field, alcohol consumption is not the same for all of us. We need to understand our own genetic risks that we bring to the table. Some scientists and researchers, doctors have written a few publications that individuals like me who have a lot of addiction in their family should pretty much ignore all of the recommended drinking requirements that we see even come out of the federal government. Is it safe for me, 4 generations above me with an alcohol or other substance use disorder to drink daily, or even if it's 1 or 2 glasses of wine or alcohol, which is the NIAAA recommendations? No, that is not advisable for me. My genes and sort of the constellation of risk factors that I bring to the table means that my decisions and behaviors around alcohol need to be changed and amended. Some of those clinicians actually recommend that those that have genetic risk only drink on special occasions. So roughly, 4 to 6 times a year. That's a very big difference from daily consumption. Now, kind of like taking this another step, talking a little bit about social norms. We hear some of these, like don't drink by yourself and don't drink before 5 p.m. And then you have jokes around it's 5 p.m. somewhere. Don't drink on an empty stomach. Don't drink and drive, obviously. These need to be updated from where we stand looking at all the research and science that has come out over the last 15 years. That first one is mind your genes, that we need to make changes and different decisions and recommendations on alcohol consumption based on our family history. Do not drink daily. We like to talk about intermittency. Think of it in terms of how many days this week did I give my brain off from drinking? And this is for adults audiences. This is not for adolescents. But when we start modeling really smart behavior when it comes to alcohol consumption, that makes a difference to the adolescents and teens around us. The question of why are you drinking? One of the biggest indicators in the substance use disorder world is when you're drinking because you're bored or you're stressed or you're unhappy or lonely. These are higher risk factors. Dealing with stress or trauma and using alcohol, marijuana, tobacco, other substances as those coping mechanisms is very damaging. Dry periods. I'm not sure how successful we were nationwide with dry January, but we could definitely make it a dry April or I don't know. We can co-opt any month of the year or recommend 2 or 3 months a year that are considered dry periods to make sure that folks can use that as a check-in point to make sure that they're aware of their own habits and behaviors that are developing. And number 5 is a very big one. Do not mix with medications. Some of the biggest risk factors that we see are individuals who mix alcohol with benzodiazepines, such as Xanax or opioids. And we don't share that information as widely as we should. So now you've had module 1, which is on your boot camp on addiction, and module 2, a little bit on sort of risk factors and more into sort of the nitty gritty. And then how do we take all of this information in science and figure out what is actually plausible and feasible to work with adolescents and teens on the prevention front. I'm going to save it, like I said, at the end, we have some videos and workbooks and toolkits and one-pagers that are available for all of you to use with your own families and networks or in your community. So I will try to make sure I leave some time for that. So the prevention 5, these are the 5 main prevention strategies that I really want to share with you all and give you tools to implement. The number 1 is age matters. Prevention is really about delaying the onset, not all out just say no for the rest of your life, particularly when it comes to alcohol. And just because someone is going to participate in a certain behavior doesn't mean they should do that in adolescent years when they're still vulnerable. So we have more data, and I'm going to dig into this, but age matters. Preventing delaying onset, how we can really work on that better. Onset is getting earlier, not later. So I think we need to double down our efforts on this one component. Risk and protective factors, how do we share that information, particularly around the genetic risk and vulnerability that literally we have 50 million, this doesn't include nicotine either, it should, but just looking at alcohol and other substance use disorders, if we have 50 million individuals struggling or in recovery today, and sort of their children and their grandchildren and their family networks, there's a high risk among siblings as well. And so if we are doing a better job of explaining how we manage risk and protective factors with this fairly large percentage of our population, we would see a major decrease in the numbers of substance use disorders, the number of people who are well and healthy and do not develop this illness in the first place. I put in number 4 because we got to talk about marijuana. As policies are changed at the state and potentially the federal level, and the policies are getting ahead of us on where we are on the science and what the data tells us, I think we need to make sure that we factor that in. And we're still seeing a lot of higher levels of marijuana usage among adolescent populations. And then I'm going to nerd out with you on something called cross-sensitization, which sounds a little intimidating. It doesn't make a lot of sense, but I'm going to dig in and have a couple metaphors to share on how we can sort of spread this concept and the research, the science behind this, and use it as a prevention strategy. So first off, age matters. So I mentioned earlier that 90% of those that have an addiction began use in their adolescent years. There's like I think the Partnership to End Addiction did this study years ago with CASA at Columbia University, but 1 in 4 Americans who begin sort of usage of alcohol, tobacco, marijuana, so the big 3, but begin usage of substances, they began before the age of 18. So roughly you have a 1 in 4 chance of developing an addiction when that use begins before the age of 18. That changes to a 1 in 25 chance when you delay onset to after the age of 21. So 1 in 4 chance compared to a 1 in 25 chance, right? Can you imagine in our COVID-focused world that we're in right now, all of us trying to not get COVID or get vaccinated or keep our family and loved ones safe, walking into a room where you have a 1 in 4 chance of developing an illness versus a separate room where you have a 1 in 25 chance of developing an illness. I'm going to stay in the 1 in 25 room myself, and I'm sure you all would want to. And these are the different rooms between usage beginning before the age of 18 and use starting after the age of 21 or after the age of 18. So huge differences in risk level and how we can protect adolescents and spreading this information and really building it into a lot of the education and efforts within our adult helpers or caregiver world is really, really important. A lot of what our parent communities can sometimes think is like, oh no, my concern here is drunk driving. And I'm going to keep them safe by letting them drink here in my own home. I'm going to collect all the keys and keep them safe from the road and other drivers and whatnot. And that might be true, But when you add to the items for us moms and dads to worry about, that I want to keep their brains safe. I don't want my allowing this activity to put us in the 1 in 4 room. I'm going to make my expectations and work to delay onset so my kid is in that 1 in 25 room. So again, not to beat a dead horse, but delay, 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 delay. I think we've seen kind of a little bit of a backfiring on some earlier prevention messages. And I think when we get a little bit more nuanced to talk about delaying onset and the importance of protecting our kids' brains while they're still in these sort of hyper developing periods of time, that has more resonance than sort of just say no and sort of mistaking some of these prevention strategies and science into sort of oversimplified concepts. And the reality is this is about delaying. My teenage sons are probably going to drink alcohol at some point. My goal is to push that back as long as possible, particularly given the genes that they got from their mom. So that's one of my goals. I would like to really push back anything that they end up smoking, because that's an even higher risk factor for adolescent brains. But when we train parents to think about this differently and to understand the consequences, and the real risk factors that this presents to their kids, there's nothing more powerful than a worried mom or dad. When we put the right information into those hands, I think that they can help help us move our prevention strategies closer to this and understanding why age matters. So the why, it's interesting. We know that teens and adolescent brains are sort of risk takers by nature, right? So when I sit down, and if I tonight at dinner was going to sit down with my kids and show them the same slides I've shown you about carcinogens and wine and alcohol and the risk factors of cancer and heart disease and liver disease for alcohol consumption, their eyes are going to glaze over and they are not going to give pretty much a diddly squat about any of that. It's the beauty of the adolescent brain. So it makes us, I think, in the prevention world as well as in the parent world, we need to up our game. And one of the key factors that I think we can use as a prevention strategy is this brain scan image that I'm going to explain to you. But when we let on to our adolescent audiences that they have something cooler than the adults around them, their brains are these sort of rapid firing supercomputers that are orange and yellow and green, and they can learn languages quicker than we can. They can learn instruments quicker than we can. They can take in more content, that they are better than ours in so many different ways, because my brain is over here on the left or on the right side, not the left. It is blue and boring. I am not rapidly developing. I'm not learning new languages at the lightning speed. Because I am sort of in this post-adolescent development stage of rapid plasticity, rapid development and plasticity. When we sort of impart on our kids that they have something to protect that is valuable, and that is only in this rapid development period until in the early 20s for both males and females, I think it gives them, it's a different way to share the sort of the same content about why delaying onset is so incredibly important. That's why our campaign and some of the videos I'm going to show you are all around a protect your brain concept, and it gives kids this feeling that they have something to cherish and protect, versus sort of more scare tactics or data that isn't going to resonate with them as much. The other part that is important in some of these lessons is as they can learn things more quickly, they can also be harmed more easily than adult brains. So this is the brain scans and the why into the age matters and why delaying onset is so critical. The more we push this back into when this brain is blue and sort of less in rapid development, the more protected it is from addiction. Now, I think I already went over through this is the risk levels based on age, but as you can see, As you start initiating closer into your early 20s or after the age of 26, the risk level of developing addiction plummets. Right. So this is our goal and our why in developing strategies that delay onset of adolescent use of all substances. Now, just a quick note about marijuana. And this is sort of a tee up to the cross-sensitization piece. We know that marijuana, particularly among adolescents, affects executive functioning. We know that's going to affect IQ and sort of your organizational abilities. And this has no effect that we found in sharing this with a lot of younger adolescent audiences, but for a parent audience, incredibly important to describe that, as well as number two, mental health triggers. Sort of the levels of adolescent and young adult suicide increasing over when marijuana is present is very concerning to me, as well as psychosis episodes and sort of the age at which marijuana, particularly edibles, are introduced into an adolescent brain is incredibly important. And this all sort of leads towards this kind of intimidating concept or name of cross-sensitization. And that just means that when you're in that beautiful green and orange and yellow phase of development, when you introduce the data and research tells us when you introduce alcohol, marijuana, or nicotine, it can prime the brain for addiction, meaning that it can sensitize that brain to addiction for their lifetime, right? So this isn't an acute sensitization. This is an increased risk of developing an addiction based on the introduction of these three substances to an adolescent brain throughout the course of that individual's life. Now, a way to explain that, here is my explanation. Primed, so the green, beautiful yellow, red, orange, and green brain is kind of like this really well-tilled garden or plot of land on the left, right? When you prime the brain by introducing alcohol, marijuana, or tobacco early in adolescence, this is what you're basically doing. You are making it easier for that seed to plant, and that seed being addiction. Now, when you delay onset and you have introduction of those big three or other substances after the age of 25, this is what it looks like, right? It is not primed. It is not impossible. That's where you get your 1 in 25 of having an incidence of substance use disorder, but it is not as easy and going to be a less prevalent occurrence when you're waiting to that thing. So this is I'm working on an explainer video thing. So this is a little bit of my tinkering with some early concepts with you all. But this is, in a nutshell, what primed versus not primed is. Introduction of the big three, alcohol, tobacco, and marijuana, before the age of 21 versus introduction after. Cross-sensitization into images. Now, in terms of the resources and things that we have available, I'm hoping that I have been able to put this QR code so you can scan with your phone my screen and this publication, and we have a video around this that I'll show you at the end. It will pop up. But we know from science that there is a lot that we can share with our parent audiences, our caregiver audiences, for them to engage and deploy prevention strategies at home. And so we put this in a publication and a video, and you're welcome to share it far and wide within your own networks. But the science tells us these following things. I just want to reiterate a few of them. I think I put some sub slides in here. So talk early and often. And I have a video here. Again, there's another QR code or the link below, and all of this we'll make available after the webinar and send it to you. But the science tells us that this is a topic that you need to address, whether this is with your own kids or your family, or to share this with your own family and friend systems. Making your expectations known and talking about this. Again, you need to deal with this in an age-appropriate manner, but talking about addiction, sharing your own family's history with addiction, talking about your family's expectations, all of this is incredibly important. Now, the other part that comes in here is very clear expectations and very clear consequences. one of the biggest indicators of adolescents who do not use substances is because of their parents or whoever caregiver they're referencing. Knowing what the very clear expectations are. The expectation in my house is my parents do not want me to drink alcohol until this age, and the consequences of that, or I'm going to be on restriction with loss of these privileges for this period of time. Making sure it is incredibly clear. All of us, this is sort of human nature. We like to avoid topics that are uncomfortable. And this is not a topic that we can avoid because of discomfort. Hold on one second. Now, the other piece that I think is incredibly important is to practice refusal skills. So I work on this. I'm going to try to get away from the snoring dog. I work on this with my own teens quite regularly, but there are real skill building things that we need to do with our adolescents. We have a one-pager on this, as well as a video explainer that you can watch after this or share with friends and family. But there are categories of refusal skills that you can practice. Every time I drop one of my teens off at a party, which has been a while because we've all been in lockdown or social distancing, but every time I do, we have a mini session either before we leave or in the car about what their refusal skills are. And this even applies to us as adults. How many times have you agreed to something because you said yes before you thought about it? Do you really, you want to do this for PTA, or can you take on this other activity? We do this in our professional lives. So practicing refusal skills so that you have those talking points in your back pocket is an incredibly important strategy for all teenagers. Incredibly important. Even more important when we have college-age adolescents who are dealing with some of the stresses and the prevalence of alcohol and other substances on college campuses. So there are different categories from simple, declarative, excuses, alternatives, and reversal. I give you a little bit of a sense of this from my own kids. My kids are not all the same in which category works for them. So my oldest, and again, I think I've done a pretty good job with really clear expectations, very clear consequences. I've shared my family's history. They know that their brain is cooler than their mom's. They need to protect it. And we practice our refusal skills. So my oldest, who's a little bit more sure of himself, and probably my most confident or mouthy, he has a combination of simple or reversal. His version of this is no. And what is wrong with you? Are you an idiot? Which is probably not the language I'm going to put in one of my workbooks, but that's what works for him, right? It is a very simple declarative, and sometimes a reversal to turn it a little bit back on the individual that that has engaged him or presented him with vaping or a vape or alcohol or marijuana. Now, my middle is a little bit more less in the declarative thing. So he likes the excuse realm, right? So his number one excuse is, no, my mom drug tests me every Sunday morning. Sorry, man. Now, I don't really drug test him. I would if things were tricky, but I am his excuse, right? Sort of the specter of a very strict mom and parent is his excuse to anything that makes him uncomfortable from his peer group. And I'm totally okay with that. A little less sort of austere methods might be no, like I have a really big game coming up, or no, I'm a designated driver tonight. I whatever it might be, I have a really big test, or yeah, that doesn't sit well with me, or whatnot. Alternatives. No, but can I grab a water? Or no, but I'm going to go get a snack. Do you want one? Sort of changing the subject or doing a sort of about face to another request can be a good way to cut off that conversation. But I think the message here is, though, that us as parents and as preventionists and as teachers and all the audiences that care about preventing adolescent substance use, it isn't just a matter of these are my consequences. I don't want you to use substances while your brain is vulnerable. We need to practice real skills with adolescents to give them the real life pieces that they need to follow through with that expectation. And practicing refusal skills is one of the most important things that we can and should be doing with all kids starting in middle school years, in my opinion. We work with a lot of individuals that are in recovery or early in treatment. And some of the age of onset, like when you look at an average age of onset at 10 or 11 with individuals who are struggling with really severe addictions, really sort of pulls at my heart and reminds me that doubling down in the prevention piece to delay that onset and give kids the pieces that they need to keep their brains safe and to avoid addiction is the best strategy ever. And this is one of the pieces. We have free downloadable videos and worksheets. There's like a 1-pager on this, and then you can like do a little worksheet with your own teens or other folks in your classroom or in your church group or in your Boy Scout group, whatever it is. But every teen, if they have their go-to refusal skills ready to go, will be more prepared for social environments that in so many cases are risky. There's peer pressure. There are tricky situations that they don't know how to exit or to manage without us, the adult helpers in their life, giving them the skills that they need. Now, similar to this is an escape plan. So my kids and I, we have this. I think it's called like the exit strategy or an X strategy, and has been around for a while. To have a code word or some type of signaling in your family or in families that you work with, so that the teen or adolescent can indicate in one emoji, I think is helpful, that they need to be picked up and there's no questions asked, or this isn't a situation for them to get in trouble, but for them to be asking for a clean exit. So in our case, they send me a lawnmower emoji. I'm not exactly sure why it's a lawnmower. I think it's because like lawnmowers, you really kind of want to get out of the way of, and you don't want them to run you over. And that's a little bit what it must feel like when you are a middle schooler and all of a sudden you look around and you're in a pretty risky situation and you'd like to exit it without losing face or social status. So it becomes hey, Jack, I got to pick you up in 10 minutes. I forgot that we have a game or a Zoom call with, your auntie, or you need to help me babysit your younger brother tonight. Whatever it might be, having an exit strategy on top of refusal skills is the 1-2 punch that can be a game changer for our adolescents. There has been 4 situations where my middle kid has used an exit strategy. And I haven't had an exit strategy. I haven't had a lawnmower from my oldest or my youngest, but my youngest is just in 7th grade. So I'm going to gear up on my refusal skills and my exit strategies so they know that I'm here. They drop a pin where they're at to remind me that I can get my GPS going and be with them, and they know how long it's going to take me to pick them up. So. Now, the other piece, I feel like I'm reiterating here, maybe more than I need to with you all, but the intervening early piece. I think sometimes addiction is uncomfortable. It's uncomfortable even for me, and I run an addiction nonprofit, and I've been doing this since 1992, which is a really long time. It's uncomfortable to talk about people's drinking or addiction. It's even kind of uncomfortable to talk about this within our own family systems. But talking about it and noticing things that are going sideways early can mean a huge difference. When you seek treatment or seek help, when you start to develop an addiction, when you are 16 or 17 or 18, the chances of full recovery and for the tissue to repair more quickly and for there not to be other sort of damage that has occurred during the course of the illness is so much better at the onset of that illness rather than waiting until their 20s or 30s when that illness has really caused a lot of damage, both physically and personally and socially. So we know to intervene early when it comes to cancer or heart disease or we know to intervene early before diabetes. We don't want to, see things amputated or sort of real risk of life. And the same is true for addiction. The quicker that we intervene at the onset of this illness, the better the chances are for survival and full health. And that is an incredibly important reminder that we try to bring out into our communities we work in every day. Now, the last portion of this, I think I'm on track for time and I can still show you some videos, but it's a little bit on the responding to a disease part, right? So let's think of COVID or HIV or breast cancer. When there's any illness that we see, we want to reduce the number of people that contract it, right? We just saw that, like wear your mask and socially distance and let's get our rates of infection down. Early detection and intervention, breast cancer screenings, mammograms, all of this to increase detection and early intervention and treatment with breast cancer has made a huge dent in reducing the fatality rates of breast cancer, right? We want to improve survival rates. We want people to survive the illness should they contract it and whenever we detect it, whether it's early or late. And so taking those lessons from a disease model and applying that to the addiction space is really what our work is every single day. So I mentioned a little bit on the rock bottom piece. I have a rock bottom video I can share with you. It's one of my favorite cartoons that we've done, just because I think this is such an entrenched, miseducation that we've done in our communities. But we need to lift up the bottom, right? We know that 90% of addiction was developed in adolescence, but even our treatment system is built around adults. So it's the only treatment system in America where we wait for it to worsen before we intervene. But we, working in communities, you as sort of community leaders and parents and teachers and preventionists, you can change the trajectory of that so that we're intervening quicker and improving that rates of surviving. Now, the other piece, and this is this is an older version of our video here. We have an updated version that doesn't have guns present, so you guys can use whichever version you feel more comfortable with. But we talk a little bit about this stat that comes out of SAMHSA, that of all those 20 million who have an addiction that's active, only 95% will be connected with specialty treatment or treatment this year, right? Or 95% won't be connected with treatment or specialty treatment, right? So only 5% are going to get help and 95% won't. Now, sometimes we misinterpret this data point, in my opinion. Sometimes we think we don't have enough treatment or we can't afford it or treatment's not available. So this is why the vast majority of folks with an addiction won't get help. Well, that's not true. For any of you who have a family member or a loved one struggling, or you yourself need help, there is help right around you. There is free help. 90 and 90, doing 90 meetings of a support group is equivalent to going to inpatient in terms of its efficacy, and that's free. Or you put $1 in the basket as you leave. So there are strategies. There's opioid treatment programs and office-based opioid programs. There's medications for both alcohol use disorder and opioid use disorder. We have more treatment than we know what to do with in this country. We really do. There are effective treatments available for all substance use disorders. The 95% that don't engage in treatment, it's because the nature of addiction, it is a brain disorder, right? It is a disease that's telling you that you don't need to get help. It sort of entrenches itself and has some backup plans by making you feel really terrible and sick when you don't use. And so it kind of keeps its own self, it's the addiction and safe in that host, right? Can you imagine if like COVID or the flu could employ this type of strategy and it like was telling you you don't need more fluids or to see a doctor or to go get some meds? Like that would be awful. And it's sort of the nature of addiction because it compromises your limbic system and your prefrontal cortex. It is telling the individuals that are struggling with addiction to sort of maintain status quo. It's almost to protect itself. So for those of us who are around and in the community, it means that when we speak up, when we intervene, when we use our levers, and I use this levers concept because if you think about it, it's almost like most of the time, and I can tell you what the levers are with my mom, something is kind of prying that hijacker out of the brain, right? Now, it might be like a very sort of a simple thing like a letter from your best friend, or a sit-down conversation from your mom or your girlfriend or your spouse or a friend or your pastor or your boss. It could be sort of a light lever usage of an intervening conversation. Oftentimes it's a DUI or your second DUI, or it's winding up on probation or in the criminal justice system. It's the loss of a relationship or a job or your children. There can be different intervening moments, but the quicker and the earlier we move up these intervention, and the more of us that are able to use our levers to pop out that hijacker out of that brain sooner rather than later. Right? We all have a role to play here. I talk about sort of no missed opportunities. If this is an illness that begins in adolescence, then how can we make sure that every middle and high school teacher and everyone in the college system, everyone within family systems and churches, as parents and family members reach out, I don't know what to do. I think that, Jessica is drinking too much and I'm really worried about her. When we build our levers and when we strengthen our levers at the family level, at the school level, at the church and social systems level, we improve our ability to intervene earlier and change the trajectory of this disease. So that's why it's important for us to all understand how to prevent this illness, but also know how to use our levers when someone is developing a substance use disorder or showing symptoms of having an addiction. Now, we have another free resource that's available. It's called Navigating Addiction. It's a guide for families. We have a worksheet here. I talk about this as how to have one of the most awkward conversations in your life. And please download our toolkit and our spreadsheets and worksheet to make that easier. I on average, have to have this conversation more often than I would like, even in the work that I do. And so when you set your mind to it and you use a worksheet or you plan ahead, and even if it's simple as, I have Braden Kelly, who's on my team and a great partner. If this was me as a colleague saying, Braden, talking to me like, hey, Jess, I've noticed that you've been drinking a little heavily during the pandemic, and I'm a little worried about you. As an example, I've seen that you've missed a few meetings in the morning because you look like you were a little hungover. You've talked a little bit about drinking pretty heavily. And I want you to know that I care about you and I care about your health, and I'm here to help you find a plan, whether that's just cutting back or maybe getting an assessment to see if you might have an alcohol use disorder. I'm here as a friend to help you out, Jess. Those are conversations none of us really want to have, but the more we have them earlier into the progression of this illness, the more people we are going to help and help them stay healthy and make sure that they find recovery and not waiting. It's so much easier to sort of turn away and pretend that you don't see what's happening around us, but particularly with increases in drinking that are happening nationwide, we all need to use our lever and have mindful and loving conversations with people that we are worried about. Other few communication tips. If you have an uncomfortable conversation, please reach out if we can help at all. But it's about empathy and information and not about being angry. Like I said, this can be a pretty entrenched disease. And so if someone doesn't respond positively, I think you just reiterate a message of care and concern. I understand, Jess, or I understand, Braden, that you might not be ready to look at this right now, but I want you to know I care about you. And when you're ready, I'm here for you. Right. And then revisiting it as often as you need to until you take care of that person that you love and they take care of themselves and get help for their illness. Now, I have a little bit more that if you want to dig into the different types of treatment and assessment, like having a mental health disorder, there are evidence-based tools to assess whether or not someone has a substance use disorder. And you need to make sure that you find a place that isn't making up their own assessment that tells you to come there, especially if you have enough money or insurance to pay for it. This needs to be a validated assessment tool that really gets you to an evidence-based treatment and place of care. A little bit on, the sort of treatment options. We get a little confused, and we have like a comparison to sort of cancer treatment here too, but there are three different things that you need to think about. You need to think about settings, like the place that you go, the clinicians who treats you, and the interventions. What are they giving you in terms of that treatment plan? Sometimes we think very much in the addiction space that the setting is it, right? I need to find a residential treatment place and that's it. Well, that's not true, right? That would be saying I need to find a hospital because I have cancer and all hospitals are the same. And that's the answer. That's not true. I might need to find a right hospital or oncologist to treat my cancer. But the real question is, what are the interventions? Are they going to give me, am I going to get surgery plus radiation and also chemotherapy? Those are three interventions for cancer. So if I have a opioid use disorder, am I going to get an assessment? Do you provide all three forms of medication for addiction treatment? Are there group counseling sessions or cognitive behavioral therapy, CBT, which is incredibly helpful in treating addiction? So when we arm ourselves with what treatment should look like, and we know the difference between settings, clinicians, and interventions, we can demand better care for our loved ones and ourselves. I talked a little bit about this with MAT, medication for addiction treatment, particularly on the alcohol side. We have several MATs for alcohol use disorder, and they are underutilized. And so making sure that individuals who need treatment for an AUD know where to find medications and medication support in their community is incredibly important. Medications work by helping with the physiological symptoms of withdrawal, blocking euphoric effects, particularly with opioid use disorder, and helping with other symptoms or other efficacy of alcohol use. So here's an example, especially this is on the opioid side, but naltrexone is also prescribed for alcohol use disorder, either in the pill form or in a long-acting injectable called Vivitrol. Incredibly effective for alcohol use disorder, totally underutilized. And what that does, in the receptors in your brain that are sort of affected by substance use disorder, particularly alcohol use and opioid use, naltrexone in effect puts like a cap on that receptor. So nothing is engaging there, right? So even if you were going to use opioids or alcohol, you're not going to get the same effect there. It can also reduce feelings of cravings and withdrawal symptoms at the same time. And in combination with other interventions, can be incredibly effective at helping someone newly in treatment find stability and sort of provide that calming effect on the receptor area of your brain to calm it down, almost reduce the noise and the volume level. So you can do some of that important work that we need to do in the front of our brain, the prefrontal cortex. And it's hard to do that work, whether it's counseling, family counseling, cognitive behavioral therapy, dialectical behavioral therapy, contingency management, when your limbic system and sort of these physical cravings are so loud and obnoxious, it's hard to do that work. So when we let our patients and prescribe them the medications to calm that down, the combo effect, it can be incredibly important and reduce loss of life. We know this is one study that came out that you have a decrease in fatalities by almost 60% and utilizing methadone and nearly 40% for utilizing buprenorphine. There's another study that came out that for particularly individuals coming out of prison and jail who have an opioid use disorder, medication for addiction treatment reduced death by 75%. Right, having a 75% reduction in loss of life by using a medication is a pretty astonishing data point that we can share with communities so they know to use these resources and this tool in the toolbox for treating opioid use disorder. So this is the part of the program where I hope I don't make a lot of you shift a little bit in your own seats, but I think it's important for us, whether we're caregivers or professionals or work in schools or school systems or the healthcare system, is to think about our own coping skills, right? A large portion of individuals who have a substance use disorder have a less helpful coping skill that has gone sideways. So in essence, they've built sort of a crutch that usually develops in adolescence or early adulthood that they can't sort of manage even pretty mundane tasks without. So when I say I need so if I came into this and we were having a end of day Zoom as colleagues or friends and said like, wow, that was a tough day. I had a lot going on. I need our society tells you that I'm probably going to say I need a drink, right? We talk about sometimes when I give talks on coping skills and particularly alcohol usage, I talk about the 3 C's. How do we, as adults, how do we look at our own strategies and habits on how we cope with a difficult day, how we celebrate something good that happens to us, and how we commiserate with a friend? And too often, all 3 of those things involve alcohol, right? And by us as adults in the lives of our adolescents, when these coping skills or these sort of rituals of coping, celebrating, and commiserating are organized around alcohol consumption, we are sort of setting up and modeling behaviors for our own children and for our community that can go sideways for others. So when we start thinking about our own coping mechanisms and we replace I need a drink with, man, I had a rough day today. I need to run. I need to talk with my best friend or my therapist. I need a gym session. I'm going to go lift some weights or do a class. I need to hike. I need time outdoors. These are the healthier coping mechanisms that we need to talk about as families and communities to help our younger adults develop healthier versions of those. I also think that for families and friends and caregivers who have a loved one struggling with addiction, to really sort of think through your own coping skills, your own drinking patterns to be more supportive of that individual can be a really important step. The more individuals in your circle, in your social circle, whether that's family, friends, or community, who are sober or in recovery, is a protective factor for every individual in recovery themselves. So thinking through that. And then even if you don't have someone in your family or network that has an addiction, thinking of this as prevention, recognizing sort of symptoms of problematic alcohol use in ourselves, our own family systems, and correcting those now, and even being honest and having a conversation. I've had this own conversation with my boys. Every time I have a glass of wine in the presence of my teenagers is an opportunity for me to remind them why I have a blue boring brain and they have green amazing brains and can't drink. And we will revisit that topic when their brain is more able to handle introduction of something that's harmful to it. But having a conversation, it's unhealthy to drink as a coping mechanism for stress, anxiety, loneliness, boredom. I am limiting my alcohol consumption to social occasions or things that deal with meals, but not using this as an everyday coping kind of crutch that may go sideways and get out of hand is, I think, an important place for us to begin as parents and friends and community leaders to start that conversation. And again, passing that on. Like I'm taking 2 months off a year of dry January and dry October as a way to make sure that I don't rely heavily on alcohol for day-to-day stressors or functioning. I'm encouraging my friends and family to do the same, whatever this might be. I'm making sure I take 4 days a week off of any consumption of mind-altering substances to make sure I'm keeping my brain safe and reducing my carcinogen intake. Whatever this might be, I'm being mindful of the coping skills that I'm modeling for those around me. This is a way that we can all take responsibility for what's happening in our communities and be mindful of these habits and patterns that can be unhelpful to us in the end. And a couple more on the resources side. After these 2 slides, I'm going to show you a couple a couple of videos of some resources we have available. And then we'll open it up to Q&A. But I wanted to mention that we are working with Recovery Ohio in the Governor DeWine's office on launching a training for families and community members. It's called Encompass. It's an 8-hour training that sort of encompasses everything you need to learn about addiction, including self-care and how to engage. It's the longer version of the quick boot camp you all have had today. But if anyone is interested, this launches on April 22nd for Scioto County and a few other counties. And then we are launching in Columbiana County on April 26th and Butler County in early May. But these are virtual trainings. So if anyone's interested in tuning in, you can find registration details and a flyer and more information on our website, which is addictionpolicy.org. In addition to that, some of the videos I'm going to show you was part of our Protect Your Brain campaign, which we plan to launch next month. We're also looking at setting up a train the trainer model to focus on sort of teachers, preventionists, educators, and others who want to be trained in how to deliver some of this content for parent and adolescent audiences, and also how to answer the tough questions. So if anyone is interested in that, please reach out to us. We're going to recruit an initial class of 15 Protect Your Brain trainers. It will be free, but we're hoping to collect some data to show the effect and impact of the training on different audiences. And again, we want to make this as accessible as possible so we get more prevention messaging and resources out into communities. So at that, I'm going to show a couple of videos, unless you want to do Q&A and show videos after. Any preference?
I think showing the videos makes sense.
Okay, cool. All right.
Addiction and the brain. What is addiction? It's also called a substance use disorder. Over 20 million people nationwide suffer from addiction. 1 in 7 people will experience addiction at some point in their life. Scientists first began to understand addiction as a brain disorder back in the 1950s. Doctors Olds and Milner, in laboratory studies of rats, found the parts of the brain affected by addiction. But then in 1994, Doctors Volkoff and Shelbert, top neuroscientists, ran PET scans of the brain that showed the effects of substance use disorders. And like other diseases, these scans showed it affected tissue function. There are 2 main parts of the brain affected by drug use: the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So, when you do essential things to stay alive, like eat, drink, find shelter, build relationships, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling so we seek it again. This is our survival hardwiring. Addiction also affects this area up here. That's the prefrontal cortex, which is what separates us from other animals. And this is where decision-making and impulse control live. When drugs or alcohol are used, they activate the very same dopamine process in the survival center. And when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens the system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, relationships, and protecting our young. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use. So, why don't all people who use alcohol or drugs become addicted? There are factors that contribute to the development of a substance use disorder. They include individual factors, like your genes, your age of exposure, and then environmental factors, like drug availability. But there is good news. Addiction is preventable. Key factors that aid in preventing addiction can be categorized into 2 parts: risk factors and protective factors. Protective factors range from parental involvement, programs that improve self-control, limiting availability, and increasing attachment to your community. Another key element in preventing substance use disorders is to delay when use begins. Put simply, prevention is about delaying the onset of first use. In the adolescent brain, where brain tissue is more vulnerable, the hijacker is more prone to weaken the brain and plant itself as a disease. those with substance use disorders commonly initiate first use much earlier, between 12 and 18 years old, which increases the likelihood of the hijacker taking hold. But if the hijacker does take hold, addiction is treatable. Advancements have been made in assessments, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that once in recovery, the tissue in the limbic system and cortex can get better. Be smart. Protect your brain.
So that's our brain science explainer video. The next is on age.
Age matters. The adolescent brain is more vulnerable to drugs and alcohol than the adult brain. The earlier someone starts using substances, the greater their chances of developing an addiction. 90% of people with a substance use disorder began using drugs and alcohol before the age of 18. 90%. What does this mean? Age matters. Prevention is about delaying the onset of first use, pushing it back as long as possible, whether alcohol, tobacco, or marijuana, the most commonly used substances by teens. Early use of alcohol or drugs can disrupt brain development and increase the risk of developing an addiction later in life. Protecting the brain during this time is important, as the adolescent brain is rapidly developing, learning, and changing all of the time. It can learn a language or an instrument more quickly than an adult brain, and can also be damaged more easily than an adult's. The brain continues to develop until a person is in their early to mid-20s, with the regions of the brain that control emotions and impulse control among the last to develop. Be smart. Protect your brain.
And Mind Your Genes is the next in our Protect Your Brain series.
Mind your genes. Genes are the functional unit of our DNA that direct the development of every cell in our bodies. Some diseases, such as sickle cell anemia or cystic fibrosis, are caused by a mutation in a single gene. But many diseases, such as cancer, heart disease, and substance use disorder, involve variations in many different genes. We often hear that addiction can run in families. Research suggests that genetics account for 50% of a person's likelihood of developing an addiction, but the risk of developing a substance use disorder is also influenced by lifestyle and individual choices. Information is power. Knowing about a family history of addiction empowers us to make different decisions about using substances. So if addiction runs in your family, will you struggle too? Scientists have discovered that it's the interaction of your genes and experiences that affects your health. Your environmental exposure and the choices you make can change how your genes are expressed, meaning which genes are switched on or off. This is called epigenetics, the study of how behavior and choices affect the way your genes work. Epi means above or in addition to. While you can't change your genes, you can change which genes are switched on and off, and how they affect your health. Even with a family history of addiction, you can reduce your risk of developing a substance use disorder by doing things to keep the addiction switch turned off, like delaying substance use until your brain has matured in your 20s. Learning skills to help you cope with stress and express emotions in healthy ways. Even limiting alcohol use throughout your lifetime to stay healthy. Be smart. Protect your brain.
I think. And last but not least,
things parents can do to prevent addiction. It's our job to protect our kids and keep them safe. We hold them close as they get their first shots, teach them to look both ways before crossing the street, and help them develop healthy habits. We know that keeping children safe from addiction is also a high priority. Here are 12 things parents can do to protect teens from addiction. Number 1, talk early and often. Children whose parents talk to them about the risks of drugs and alcohol use are 50% less likely to use substances. It's important for teens to delay substance use until their brain is fully developed. The adolescent brain doesn't fully develop until age 22 for girls and 25 for boys. It can develop an addiction more quickly during this time and be damaged more easily than the adult brain. 90% of people with an addiction began using before the age of 18. If your family has a history of addiction, you can discuss this with your child. Stress the need to be more cautious. A genetic predisposition can make a person more susceptible to addiction, especially if use begins early. Number 2, support healthy activities. 2 of the key factors that reduce the risk of kids developing addictions are healthy attachment and pro-social engagement, which means feeling like you belong and being engaged in positive activities, whether it's sports, music, drama, volunteering, or STEM. Kids do better when they are kept busy and feel part of a healthy community. Number 3, set clear expectations. Be clear with your child that you expect them not to use alcohol or drugs. More than 80% of kids say their parents are the biggest influence on their decision to drink or not drink alcohol. Number 4, practice refusal skills. Practice key messaging that your child can use in risky situations, such as, "No, I'm the designated driver." "No, I have a big game tomorrow." Or, "No, my mom is strict about that stuff." Number 5, establish clear consequences. Be clear and consistent about the immediate consequences of alcohol and drug use in your family. Number 6, it's not your job to be cool. It's tempting to want to be friends with our kids, but what they need most is a parent to guide them safely into adulthood by setting clear expectations and holding them accountable. Number 7, do not provide alcohol or drugs to your teens. It's understandable to think that kids would be safer doing something if we were there to monitor them, but this doesn't extend to substance use. Parents condoning or supplying alcohol to their teens, sometimes referred to as social hosting, increases adolescent alcohol usage, as well as other unsafe behaviors. Number 8, pay close attention. It can seem like kids need us less as they grow up, but staying engaged throughout the adolescent years is critically important. Build relationships with other parents in your community. Work with them to keep tabs on where teens are gathering and what they're doing. Number 9, carve out family time. Research shows that spending time with family, bonding over favorite activities, or talking about your days has a long-lasting positive impact and strengthens healthy attachment, even if your teen claims they would rather be doing anything else. Number 10, make sleep a priority. Sleep is critical for mental and physical health, especially during adolescence when brains are developing rapidly. Number 11, help your teen with an escape plan. Setting up an escape plan can help your teen exit difficult situations. Decide on a secret code that they can text a parent or caregiver to be immediately picked up and exit the situation. Choose a code word or emoji that signifies they need help with an exit. It can be anything, an emoji, symbol, or a single word or letter, like exit or X. Number 12, intervene early. If you think that your teen may be struggling with substance use, don't wait to intervene. Science tells us that the earlier a person is treated for a substance use disorder, the better their outcomes. Parents and caregivers can use these evidence-based strategies to promote healthy development and prevent addiction. For more information, visit addictionpolicy.org.
All right, that's just a selection of videos that I thought I would share.
You know what, Jessica, I just wanted to jump on to let people know. I did request that Jessica show some of these videos. I know we have people from all over, but if you're from the Tusk-Carroll region, there's a couple issues on prevention that are extremely important, and in the work to reduce stigma with people struggling with addiction and in recovery that need support. Personally, I feel these videos are wonderful to share. And the more that we can strategically share them throughout the county, the greater impact we're going to have. So like right now, I know the alcohol committee, Veronica's on here. They're about to start their Parents Who Host Lose the Most campaign in mid-April. I'm going to just do a little plug for that. If you're from our area, we have about 500 yard signs. You can pick them up the United Way. If you stake them into the yard in the middle of April through prom and graduation season, parents will see those messages about it is unhealthy, illegal, not helpful to provide youth, young people, alcohol. But in addition to that, just seeing the yard sign doesn't really provide that education and information our adults need. So as a community, if we can share some of these videos, such as those, what was the name of the one? The 12 things parents can do. If we are all strategically sharing that from each agency, organization, business, it helps reinforce what those messages are. And I think the other one, clearly we're all struggling with overdoses here in the county, in the state, in our nation. When we can help people understand addiction, that's a big part of the problem that we have. And I think people understanding addiction, I think it's difficult. People just do not understand the genetic influence and environmental and everything that goes on there. And I think it takes people many different ways to hear that message. And that's another reason I really like Addiction Policy Forum's videos, because there's a whole bunch of different ways that they present that information. So I'm just going to shamefully say, if you can share, whether it's from the Addiction Policy Forum website, I saw that Braden put that website link out there, or if you go to the Anti-Drug Coalition, we will have that information there as well. But the more we can share that, the more we educate and inform our population, we create awareness. And if parents will start understanding and have these conversations with our young people, it will be very helpful. So I just wanted to throw that out there. And I also wanted to say to Jessica and her team, these resources are very valuable to our communities.
Well, I appreciate that. We do have a partner toolkit for all of these videos and resources. And so you could even deploy that at the same time and all be having sample tweets and Facebook messages and videos. So I can share that with you, Jody, and hopefully that you could work on sharing the campaign countywide.
That would be wonderful.
I also have 4 people who've signed up to be Protect Your Brain, Train the Trainers, which is very exciting.
Wonderful.
Does anyone have questions on any of the modules? And we have a toolkit request for Stark County.
Jessica, did you want questions just out loud or did you want them in chat?
Either way.
Okay, I have 2. First, you referenced carcinogens and wine. Would the stats for cigarettes to wine be the same for beer and other alcohol?
That study was specific to wine. There have been other studies on beer and other liquors. Some have more carcinogens than others, but we can send you sort of a summary. The short answer is they all have carcinogens present and all are linked to different forms of cancer.
Okay. And the second is, do you have any information or stats on adolescent usage outcomes for kids who are coming from a home where both parents are alcohol and drug abstinent?
That's a good question. I don't think I do, but I can check in with our science team and NIDA to see if they have anything, what parental abstinence does for prevention outcomes. Yeah, I'll check on that and get back to you.
I appreciate that. Thank you.
More questions? I know I threw a lot at you. Y'all basically had a 2-hour boot camp.
There's a request for another toolkit for Licking County, Pathways of Central Ohio, in the chat.
If you're interested in being a train the trainer, receiving the toolkit, or I'll do a follow-up of links to all of our videos or resources. If you could email me at jhulsey@addictionpolicy.org so I don't miss anyone, or I can send everything to you, Jody and Veronica, if that's preferable.
We can do it either way. I'll put your email. I think I have it right. I put it in the chat.
Great. If you want follow-up materials, you have questions and you're feeling shy or would like to be a train the trainer, or if you're interested in the full 8-hour training later in April, or bringing the Encompass training to your community, we are trying to do 23 trainings throughout Ohio this year. That really gives Jody was entirely right. Just about 50% of people in our country don't understand addiction as a health condition. So we are trying to really make information that's accessible and understandable available at a different level.
There's a question. Can we get a copy of the PowerPoint?
Sure.
A question that I have is my background has been in mental health, but now I'm working for an educational service center, working in the education sector. Educators are so used to, and they're really good at it, teaching academics by tiers. What do all students get? What do students that need additional support get? What I'm struggling to find in the prevention space is having that quality. Here's what we do for all students and families universally. Here's what we do for students that need additional support. Here's what in families that need additional support. Here's what we do for those that need individualized, and have it like organized in that way. So if we're really about comprehensive, instead of throwing throwing splatter dots at walls, is how we can kind of put those pieces and parts together. Because if we're just showing and getting out videos here and posters here, and some students are getting this content, that's why I got really pumped when I heard you talk about the Protect Your Brain, because I think if we start getting to where we give content to all students around, here's all the things that will help your brain be healthy. But I don't know. If there's anything to guide me to guide educators to, that is just much more kind of organized and thoughtful about how they could be organizing their content in the prevention space.
So there's a couple things that are out there that I like that do a little bit of that tiered approach. So Project Success, which started in New York, is a student assistance program, kind of like an employee assistance program, but for middle, high, and high school students as well as college. And so the model that they deploy is there's the foundational information on prevention that's available to everyone. And the other thing that's really important is it's not drug education, it's prevention, right? We've gotten this wrong in the past. So some resilience building. I like the Protect Your Brain thing because it's worked well in some of our focus groups, because you're working for your actual audience, which is adolescents, and they like to feel like they have something to be protected or treasured, or that is better than everyone else's, right? And something that's superior to the adults in their life is an even bigger bonus. Showing them the difference between how to identify heroin versus methamphetamine doesn't. We know that doesn't work. So Project Success has the basic level. Protect Your Brain, I have one more video that I'm working on to complete the series, and I hope to have it ready in May. And I'm looking for a partner to pilot it. So if you're interested in testing it out, what we like to do is have something that we have a train the trainer model that we do some training to make sure people are well prepared to deploy the information, and you got to be able to answer the tough questions. But then it can go like wildfire after that, because you could, because if you do for a pay for play, which so much materials or curriculum are, it just won't spread fast enough. And we're behind the ball on this. So our goal with PYB is to have that foundational piece. But Project Success, how they look at that tiered approach is that if there is substance misuse or someone who needs help, then they enter the sort of student assistance program, and the families enter that as well. So there's the higher level of engagement. So in lieu of suspension or expulsion as sort of the response to drug use or sort of drug or alcohol possession, they enter the program. And there's, sort of consequences for noncompliance. It has accountability. The parents are included in that because oftentimes there will be some issues that need to be addressed at the family level. So I like Project Success. I like the student assistance program. I think you could build that on your own with the linkage to behavioral health partners for the follow-up engagement for intervention, and then having whatever curriculum you choose to be the basic level of knowledge and information. And what I think I'd love to see this tested is to do a bi-directional foundational piece. You've got to get the information in the hands of adolescents themselves, and you can't wait till they're juniors. It has to be at a younger level so you can embed some of these sort of resiliency and prevention messages or ideas, but then also getting to the parents at the same time. And again, I would go a little bit younger before, high school parents run out of a little bit of steam. That's the only way I can describe it. We all seem to, I include myself in there. We run out of steam. We are labeling everything and BPA focused when they're toddlers and in kindergarten and second grade. And then we start to run out of steam or feel like that we're in the clear later on, and we're really not. So I think if you gauge a little bit younger high school or middle school, foundational for all of the students, as well as some piece. There's one West Virginia coalition that I love, and how they pull this off is you can't get a parking pass or like go to the prom unless the parents come and do their required thing. So it's not required. There's a benefit to it, but there's something that's motivational or motivates a parent audience to engage, to learn some of the parent content, because it's really hard. But even if you can't pull the parent thing off, having the foundational piece for the students is helpful. It's also going to educate your teachers simultaneously. And then I would have some type of student assistance program in lieu of expulsion or suspension because of infractions that are related to any substance, and then bring in a behavioral health partner on what that looks like.
Jessica or Patrice, I'd just like to jump in as well. The other thing you can do if you're an educator from a school system here in Ohio, I would reach out to who is your credentialed prevention provider in your county or in your district area, and community coalitions. Anyone that's certified in prevention really has a very strong understanding of universal secondary and tertiary prevention. And they're going to be using, there's like 16 prevention strategies from NIDA that kind of says, if we are doing X, Y, and Z, if we are providing universal prevention education at crucial areas, levels in your school system, that is helpful. Anytime you have those transitional years, if it's combined with the community plan. So your community coalitions really should be looking at a strategic plan of how they are rolling out prevention efforts. And then it's creating parent and school bonding, student and school bonding. So those prevention credentialed programming, they're also going to be using evidence-based programs. So, they're not willy-nilly picking out, oh, this sounds good, or, hey, let's just shoot this out and see how it works. They should be really having a plan that says, in April, we're doing this Parents Who Host, and we're going to tie that to this education effort in the school, and this is how we're going to be educating our parents and engaging our community stakeholders. So there should be someone in your area, and if you can't, feel free to connect with myself and we can see who's in your area.
Any other questions? Well, I'll throw out there really quickly, just building on the last question. So for another tier that we've seen sort of, just working with different school systems and community leaders, another effective tier to add to that is kids who are impacted, kids like me who were impacted by parental substance use disorder. We have high risk factors, obviously, and there can be there's assessment tools that are available. UCLA has a pretty good ACEs assessment tool that We know of some Pennsylvania and Massachusetts schools that are using, but then what do you do with that information, right? So how do you provide those support systems for like the next level of kids that may not be developing a substance use disorder, but they're at risk because of other factors? And the Kaiser study on the number of adverse childhood experiences is pretty profound, sort of at risk for not only addiction and mental health conditions, but also physical health conditions and sort of a shorter lifespan, which is not great. But I think I'm proof that you can address even a high ACEs score. So there's a program called All Stars that was started by a district attorney in Essex, Massachusetts, and they have an ACEs screener for middle school students. And then kids who screen for having ACEs, 98% are due to parental substance use disorder, are included and invited to a leadership program. What I love about it is they don't dime them out by saying it's for ACEs or kids who are in foster care or living with their grandparents, because we get singled out at school enough. But it's a leadership program, and they have a behavioral health provider and art therapy, and there's, lunch and dinner provided, and they have washing machines and dryers, because there's some, basic core pieces that aren't met at home. So they're trying to sort of meet those needs. And I think that program's been going on for 7 years, and they have 0 juvenile justice involvement and kids going to college as first generation college entrants. So I think when you looking at your own community and what the needs are for tiered programming, I think what Jody said is right, that this should be part of a larger prevention strategy, but universal prevention and then some more focused programs on special needs populations, they're out there and models exist that you can replicate if you're interested. That's my kids impacted sidebar, sorry. We're all savable. Well, any more questions? I don't think I saw any in the chat that I missed.
No, I've been going through it, just making sure we didn't. I know that Diana sent out an email just a few minutes ago that has the Survey Monkey for the evaluation, and that will need to be completed, I believe Jody said, within 7 days in order to if you are in need of CEUs. The CEUs won't be issued unless you complete that survey. So,
also, we're going to be posting a copy of the presentation on the Tuscarawas County Anti-Drug Coalition YouTube page as well. So, in addition to being sent out the PowerPoint, you can access that there. There's such great information you shared today, Jessica. I know myself, I'd like to go back and review some of that. Just helpful information, I think, that will assist us in preventing youth substance use. So thank you on that.
Yeah, thank you for having me today. It was really great to see you all, and an honor. Whatever we can do to partner or help coordinate sort of deploying some of these things, we like to build new tools and resources so you all can go make mischief.
Wonderful. And guys, feel free to go check out, I encourage you to check out the Addiction Policy Forum website. In addition to those videos she showed us, there's a whole bunch of others. Some are more
edgy,
cartoon, yeah, very edgy. And when I say very edgy, it definitely will get your information, communicate to that 18 to 25-year-old in a very different way. So I like that you kind of have an arsenal of videos to kind of hit all age range, age groups, populations. So I would really encourage you checking those out and sharing that as well.
Yeah, that would be great. We have very different styles of content, so we can reach lots of audiences. And I have a pretty critical 17-year-old at home that I had to build a whole lane of cartoons for so I could save face during family dinner.
So you have a test market, huh?
I do have a test market. So I have 13, 15, 17, and then all of our amazing audiences of people that we work with. So there's very different tranches of different type of explainer videos. And we might take the same content, but put it into 5 different formats to make sure it's customized to different audiences. One of our biggest issues, we have a lot of science and knowledge, and it needs to be translated and pushed out. And if there's something that you really feel is important for you, your community to understand or know about, and there isn't that translation available, let us know. And we're listening and want to make sure we're filling the gap of translating the science into usable pieces of information and usable tools.
And I just want to kind of echo that. We have 9 different school districts in our county, and we might be talking on the same issue, and yet we will use a different video from Addiction Policy Forum at a different school, just because we know in our cultural competency what is a more appropriate video, what's going to resonate, what's going to be the most effective. So I appreciate that as well. So I think that's another reason to go check them out.
Oh, thank you.
Sure thing. Well, I'll tell you what, if we have no more questions.
Jody.
Oh, hold on. I think we have a question. Go ahead.
No,
Okay.
just in case they did not get the email.
Diana sent out an email with a survey link, and again, it's in the chat. So if you want to just copy that or click on that as we exit here, that would be wonderful. We will also send out all the resources that were requested. Veronica, I really thank you and the alcohol committee for working on this. And this was funded by what, Veronica, just so we share that?
Sorry, I muted myself. It was a SAMHSA's grant, Communities Talk.
Wonderful. Thank you for submitting for that. And again, I thank you all for attending today, and just have a great afternoon. And if you see Chris and Emily Lane, tell them thank you for lunch. If you haven't gotten it yet, I've been eating my salad here and it's delightful. So be sure to do a thanks to them. Is that all? We're all good?
Yes, thank you, everybody.
Okay, guys. Thanks for attending.
Don't close out, Judy.
Okay.